I have the honor to present the representative of the Syrian Arab Republic, His Excellency Mr. Mohammad Saif, Minister of Social Affairs and Labor. The floor is yours, Mr. Mohammad Saif, Minister of Social Affairs and Labor, Syria. Excellencies, ladies and gentlemen, colleagues representing the IBCSP, dear colleagues and friends, first of all, I would like to wish you all the success in this forum. Your Excellency, the moderator of the session, dear colleagues, the Syrian Constitution is the largest umbrella governing social protection in Syria. The Constitution stipulates for healthcare for every citizen in cases of illness. The Syrian state provides this healthcare system, and the healthcare system is an important pillar of building a society, and accordingly, the social protection system in Syria was created. The COVID-19 pandemic has greatly impacted the Syrian economy and exacerbated the economic sanctions imposed on Syria, which resulted in a negative impact on the population as a whole. Despite that, the Syrian Arab Republic continued to develop its social protection networks as part of the national strategies, aiming at providing protection to the most vulnerable, including the youth and women. The outputs of such strategies will be examined soon in a way that allows to have data that inform decision-making process. Lately, law number 21 on the rights of children was adopted, which provides a framework and a governing system for the organizations working on children's protection. And this reaffirms a serious commitment to the Children's Rights Convention of 1988. Also, two other legislations were adopted in a bid to further consolidate the social protection system. The Syrian Arab Republic also partnered with the private sector in order to widen the social protection networks in order to respond to the needs of the most vulnerable families using a number of different programs, the cash assistance programs, which engulfs or includes which benefits more than 28,000 families. Another program for the cash assistance to disabled or children with disability in association with UNICEF. Also, compensation for the workers affected by the lockdown measures pertaining to COVID-19. This program benefited 30,000 employees and workers. It was a very good way also to improve the database system. Further, and in addition to that, a large number of programs targeting the vulnerable families was implemented in collaboration with 2,000 civil society centers across the country. With regards to the main challenges pertaining to social protection, they include: one, social safety networks and the lack of technicalities or technical skills needed. Also, another challenge is the need to increase coverage and to increase the services available in order to align with the needs of the population. Dealing with these challenges hinges upon the availability of technical know-how and availability of financial resources. The Syrian Arab Republic has sent its recommendations to the regional secretariat about the declaration emanating from this conference. Last, allow me to thank you once again for inviting us to take part in this Arab Ministerial Forum on the future of social protection in the Arab region. I would like to also wish you all success in your endeavors. And we would like to thank the chairmanship of the forum, and thank you very much for your kind assistance. Thank you very much, Your Excellency, and thank you for sticking to the time. You were half a minute before the allocated time. I now give the floor to Mrs. Hessa Bint Essa Buhumaid, Minister of Community Development representing the United Arab Emirates. The floor is yours, ma'am. And thank you very much. I hope that you can hear me. Excellencies, ladies and gentlemen, it is an honor for us to be taking part in this Arab Ministerial Forum on the future of the Arab region to build a vision for the post-19 pandemic world. We would like to state how important this forum is following the preparatory meeting that took place on 21 October in order to enhance social protection and how to make them more resilient in the face of crises and emergencies. This is important to share experiences and to continue working towards meeting the SDGs and the Sustainable Agenda, the Sustainable Development Agenda 2030. I in response to the shocks and governance under the wise leadership of the United Arab Emirates, we were able to respond to the international developments and changes. We have a resilient government and we have governmental teams that are able to respond to crises. Under the leadership of His Excellency, the Prime Minister of the UAE, we have a response that is a little bit different in responding to COVID-19. We were able to provide the best services to our clients and to the patients, and we made sure to deliver those services on time and as needed. The COVID-19 pandemic has affected everyone. And right now, as we prepare for recovery, we must learn, and we must learn from the challenges and the indicators that we were able to observe. We all benefited from this period in order to improve our governance, in order to develop our practices in social protection and social healthcare must be a sustainable one and must be part of a governance system and must be based on policies and decisions that do not only respond to crises but are also able to avoid or prevent crises from happening. This means that our plans are preemptive and not just responsive to emergencies. We hope that luck will be our ally, and thank you very much for your kind attention, and sorry for going very fast. Thank you very much, Mrs. Hessa. We finished just before the time. This might be a little bit difficult for the interpreters.
Fast, and I know that interpreters want us to actually go slower. Thank you, Your Excellency. Now we are going to give the floor to the representative of the state of Libya, Her Excellency Mrs. Wafaa Al-Keilani, Minister of Social Affairs. Mrs. Keilani, you have the floor. Hello, in the name of God, most gracious, most merciful, ladies and gentlemen, Excellency, the Director General, Regional Director General of the UNICEF in the MENA region, ladies and gentlemen. Dear colleagues and participants from the Arab world, allow me first of all to thank the Lebanese state for the coordination related to the hosting of this meeting, and which is related as well to the COVID-19. In order to maintain social equality as per the international agreements, and in order as well to be true to the SDGs and Agenda 2030, looking forward of poverty in the world, and establishing public policies that could be resulting in developing social protection in the future, and to maintain the funding that is necessary to ensure a proper implementation of all the social protection laws. Excellencies, ladies and gentlemen, excellencies, dear participants from the Arab world, Libya has been pioneer in the implementation of social affairs, because it is preparing and it is offering, of course, housing and pension funds to all the categories requiring accommodation and welfare, and all of these benefits are as well established within the framework of binding laws. The state is providing funding, which means that the Libyan society is enjoying a decent life. And these laws has been ending poverty and has been keen on ending poverty for a long period of time, especially despite the COVID-19 pandemic. With the support of His Excellency, the President of the unified government, we have taken several measures, including, for example, the payment of the pensions and of the salaries that are paid to the orphans as well as to the widowed, in addition to the allocations that are given to wives and children, in addition to the allocation for the support of marriage to $1 million dinars, in addition to a series of efforts that are given to persons with disabilities and to persons with limited income. All these measures have, of course, developed social protection in the Libyan state. Excellencies, ladies and gentlemen, the technical committees have undertaken steps throughout its previous preparatory meetings, as well as the initiatives that are related to implementing the comprehensive social protection after the COVID-19. We at the state of Libya would like to highlight the principles that we have implemented, and we believe that this is definitely a very important element for social protection in the Arab world. Thank you once again for supporting this meeting. I would like as well to thank all the participants, and we hope and we wish Lebanon security and stability, and we wish all the Arab countries, of course, development and stability. Thank you very much. Thank you, Excellency Wafaa Al-Keilani from Libya. I would like as well to thank you for abiding by the time allotted to you. Now we shall move on to the Republic of Sudan, represented by Mr. Ahmad Adam Bakheet, Minister of Social Development. Excellency, you have the floor. In the name of God, most gracious, most merciful, Excellency Mrs. Chair, Excellencies, ladies and gentlemen, dear ministers and colleagues, representatives of international, regional organizations and UN agencies, God's peace, mercy, and blessings be upon you. We are very happy today to contribute and to be part of this ministerial meeting, and in order to, or building vision for a post-COVID in reality, and to take part in this parallel session on governance. I would like as well to reinforce Sudan's commitment to international frameworks within the vision of the post-COVID, and to provide social protection in the Arab world. Once again, we would like to highlight the role of social protection in providing recovery from the pandemic, and in as well maintaining social protection, and to maintain programs for social development and sustainable development, especially with the new variant outbreak. And we believe that this is, of course, a priority. This is one of the 5 priorities that are related to maintaining, of course, peace, security, and justice. And the Sudanese government believes that social protection is one of its main tools for the establishment of a state of citizenship and to the rebuilding of the social contract between the government and the citizens. And it is, of course, relying on the principles of democracy, good governance, and social justice. The establishment of a sound governance is, of course, one of our main targets and goals. The efforts in the past used to be scattered, which was, of course, a key point in terms of our social protection system. And governance is, of course, working towards And of course, the Ministry of Social Development has put all efforts in its response to the COVID pandemic, which has represented an additional challenge, which requires, of course, support and immediate support, in addition to social distancing and the disinfection of public places. These were, of course, the medical steps and the health-related steps that were related to ending the pandemic. These were, of course, the measures that were taken in order to end the violations. And, of course, the new variant is, of course, a risk. We believe that the government is now working in order to protect the poor as well as the vulnerable, in order to establish a sustainable system in Sudan. And the ministry was capable of supporting 970,000 families by means of the support and by means of the direct support and royalties, and including, of course, the support that is given to the migrants and to the refugees, which has enabled us to cover a large number of families, while and the Ministry of Social Affairs has been working on supporting with the local community committees, and it has as well worked with the labor entities, and it has made sure that all people in the world were working based on these social rules, which is, of course, related to supporting all of these entities, while, of course, the Ministry of Social Affairs has as well worked in order to verify the identities of the persons who are registered, in order as well to reduce duplication. It has adopted the national identity, which is, of course, very important to make sure that the COVID response plan is being abided by in Sudan. It was used as well by the Ministry of Social Development in order to support the families. And this is a project that is now being implemented in Sudan. Among the projects that were implemented by the ministry was the establishment of the electronic payment system for the persons on payrolls by means of the fund. The fund of course, social development, and there has been as well support in order to make sure that all these measures are needed in order to end, of course, or to limit movement during the COVID, while, of course, having the social protection plan is as well working on making sure that we have a better control. The context of work has been very important, and it has been developed throughout the strategy, let alone, of course, the joint frameworks that are established between the agencies. And this is, of course, by means of a digital platform that is related to ending the complaints, and a system or an executive digital system for the social protection systems. The Ministry of Social Development is as well providing support in order to coordinate the support that is given in Sudan. And we know that Sudan is, of course, facing a long way forward in terms of accountability. And we do hope that we'll be capable of playing our role in due time. And we want all the regions to harmonize efforts to provide sustainable support to everyone. Thank you, ladies and gentlemen. We would like to thank His Excellency, Mr. Ahmad. We already earned 2 minutes and 2 minutes in the previous interventions. Thank you very much for keeping time. So now we should to Algeria with Her Excellency Mrs. Kawthar Krikou, the Minister of National Solidarity, Family and Women's Issues. Welcome, Mrs. Kawthar. You're welcome. In the name of God, most gracious, most merciful. Excellency, Mrs. Chair, Excellencies, Ministers, Excellencies, the regional directors of the international organizations, Excellencies, the members of the participating delegations. Allow me at the outset to express my deepest appreciation for your kind invitation, the invitation that is addressed to us in order to attend this ministerial meeting, which discusses a very important topic, which is the future of social protection in the Arab world, and building a vision post-COVID-19. We would like as well to address our deepest appreciation to Dr. Rana Al-Hajjeh, the chair and moderator of the session, and would like as well to thank all the ministers. So this session, this is, of course, very important in order to make sure that sustainable development by 2030, and this agenda is related to providing a large-scale health support by means of establishing, of course, support that is on the local development. And we wish to highlight that Algeria has been working on providing medical care in addition to providing the basic services to its citizens, which reflects its keenness on providing medical support in addition to social support, which were adjusted and adapted throughout the past couple of years by means of implementing the preventive measures against COVID by reinforcing the electronic platforms that are related to monitoring the needs of the inhabitants. We believe that this mechanism is, of course, in replacement of the traditional methods of follow-up and of assessment in order to maintain a sound and a good governance. Nevertheless, of course, the social role of the state of Tunisia is very important, and social coverage relies on the principles of solidarity and harmonization of coverage, since, of course, this system is related to providing insurance for maternity, for occupational diseases, unemployment, and the pension, in addition to all occupational diseases, and it covers as well a large majority of citizens. And within this framework, national system covers the non-working mother in addition to children and to the persons who are not covered by the persons with special needs. On the long run, and in order to maintain social support, we are now working jointly with all the sectors in order to develop the social cohesion projects and on harmonizing the digital national project in order to make sure that we have a protection for avoiding, of course, double registration. Allow me at the end to thank all the persons who have prepared this meeting. I would like to thank them for their efforts, and I would like to call on all the participants to exchange good practices in order to maintain social protection for the vulnerable entities, in order to make sure that we can foster cooperation between countries. And I would like once again to reiterate my country's commitment to exchanging these experiences, considering, of course, Algeria's experience in this field. I would like to thank you for your kind listening. May God's peace, mercy, and blessings accompany you. Thank you very much, Your Excellency, for this intervention. I would like to thank you, ladies and gentlemen. I would like to thank the representatives of all 5 countries. I would like to thank you for your very important interventions. I would like to thank you for the good experiences and for the country experiences in which you have participated. And this is related to around 30 minutes for discussion. I would like to give and to present Mrs. Sonia Mohammad Abdullah Janahi from the Chamber of Commerce and Industry in Bahrain, who will be helping us in preparing the discussion, I believe by means of discussing some of the points that have been discussed, especially through the different presentations given by the countries. Please, you have the floor, Mrs. Sonia.
The themes of inclusiveness and leaving no one behind must be incorporated, obviously, in all aspects of. We need to pay special attention to various segments of society to ensure that they all live peacefully and can enjoy fulfilling lives. Social solidarity is a well-known tradition in the Arab society, and the main input towards achievement of the United Nations Goal 1, which is Sustainability Development Goals, which is eradicating hunger and poverty, is one of the key issues that even today Bahrain, as an example, has in its constitution guaranteeing social security for all Bahraini citizens to ensure a decent standard of living, housing, employment, and social welfare. These aspects are pillars of government action plans and national development strategy, which are regularly overseen by the cabinet and which is important for every country to take into perspective. Although the Social Insurance Organization in many countries, including Bahrain, falls under the government umbrella, in Bahrain, as an example, the board of directors is inclusive of all stakeholders. We have different members of the society being representative in the board, and this includes the Bahrain Chamber of Commerce, it includes the union representatives, and it also includes government entities like Ministry of Finance, which has an important role. It clearly shows the inclusiveness and the voice of all the parties represented so that we can all work together on all legislations, on all corrective measures. And I don't want to say this one out.
عفوا من فضلكم please the muting من فضلكم please توقفوا المايكس. Please go ahead, Sonia.
أنا في البيت.
Sonia, Sonia, you are muted. Sorry.
الحين okay?
Yes, حين كويس.
Thank you so much. Thank you. It's very important to be inclusive in the board provision of all social protection organizations to have voices of all the community to ensure that everybody's voice can be heard, be it the business community, be it which is the private sector, be it the union, which is basically the workers, and be it the government. So this inclusion of all members in a board level of social insurance is important, and this is what Bahrain has done today. And we are in a situation that any reforms, أي إصلاحات اليوم قاعدة تصير, every member has a right to say yes or no, or to basically input their opinion. And this is what is important for every country that is representative today to take into consideration, to have unified efforts. And similar to that, we also want to focus on unified efforts between all Arab countries to ensure that we jointly and we share experiences and stories and examples. And we also focus on having the protective social protection system that is available for all. When it comes to social protection, also we need to focus also on the non-locals, because migrant workers are important to every country's economy and they occupy necessary labor-intensive positions. Having them included in social protection schemes is very important. Today, Bahrain, as an example, has unemployment for non-Bahrainis. At the same time, work injuries is inclusive of non-Bahrainis. We are also have raised today to the government to consider the indemnity for non-Bahrainis to be inclusive under the social protection scheme, so that they can have a guarantee of receiving their indemnity towards the efforts and the works that they have. These are important elements that need to be taken into perspective for every country. In summary, above all, inclusion is one of the most important things that we need to look at, and leaving no one behind is the other issue. And thank you very much.
Yes, thank you. Thank you very much.
Thank you very much, Mrs. Sonia. So this is actually a great opening to the discussion that we will be having for the next 20 minutes. I would like to ask whoever wishes to express any given opinion related to the topic of governance to kindly raise their hands. So whoever wants to take the floor is kindly requested to raise his or her hand, so that we can know who wishes to ask any question or who has any whoever has any comment. I believe that several key issues have been raised based on the participations and interventions of their excellencies when we talk about the policies, when we talk about the policies that are incepted by the countries in order to provide them social protection. These are very important issues. We have had from many countries comments related to the measures that were taken, especially during the pandemic, and that are related, of course, to remedying to some of the key needs arising post-COVID, with the increased number of unemployment. We have heard a lot of comments related to the digital platforms initiated by the countries. This was one of the key achievements for countries, because I'm confident that the COVID outbreak has actually activated the use of online platforms. And if you have any questions, if you have any intervention from the participants, from any of the participants, kindly raise your hands so that we can give them the floor.
Dr. Rana, there are two hands raised.
Mrs. Janan Al-Jabari, you have the floor, and then we have an intervention from Oman, Mrs. Shamsa Al-Husni. We shall start with Mrs. Janan Al-Jabari. Kindly introduce yourself, introduce the country that you are representing, and kindly unmute. Thank you, ladies and gentlemen. I would like to thank you for this excellent meeting. My name is Janan Ajaberi. I am a PhD holder in social policies. I am as well a researcher and a consultant, and I'm as well working on social protection in Iraq. I have a question. I am not sure whether it's relevant or not, but in all cases, I will share it with you. It is related to gender social protection. With the COVID pandemic, what is the impact on women? Because, of course, the impact on women is double-fold or maybe threefold the impact on women. To what extent do governments keep in mind and take into account the gender perspective in the drafting of the social protection policies? So to what extent is this issue a matter of key concern? Because we know that on the list we have, of course, the children, elderly persons with disabilities, but to what extent is gender being given due attention when it comes to this topic? Thank you very much. Thank you very much, Mrs. Janan Al-Jabiri. A very important question. Let us take a couple of questions, and then I can give the floor to the participants. The next intervention from Oman, Mrs. Shamsa Al-Husni, you have the floor. God's peace, mercy, and blessings be upon you. My name is Shamsa Al-Husni from the Ministry of Social Development in the Sultanate of Oman. I wanted actually to benefit from the presentation that was given related to the country experiences. Usually, whenever we have a reform of the social protection systems, we know that there are more than one stakeholder playing a very important role. It could be easy to talk about digital platforms. However, this is a matter of key concern in terms of determining the role and ensuring their actually interrelation. So what are the countries that have actually taken milestones, and what are the measures that they have taken, and that could be actually lessons of good practices? The chair is kindly requested to unmute. Thank you, Mrs. Shamsa, for your question. I do not see any more raised hands, so maybe we can give the floor to any of their excellencies who are here with us. If you would like to actually respond to any of the questions related to the gender violence. So this is why I'm wearing orange. During this period of time, we have 16 days. So this is actually an opportunity in order to raise attention to the matters of violence against women. There was as well a question raised by Oman related to the multi-sectoral approach. What are the challenges that you have faced? Anyone wants to share with us? Maybe Mrs. Kawthar, Her Excellency Mrs. Kawthar from Algeria, wants to give a response. Thank you, Mrs. Chair. I would like to thank you, their excellencies. So I have heard many comments related to the policy, to the state policies when it comes to combating violence against women. And of course, the problems encountered by women throughout this health crisis. In Algeria, we have taken a milestone when it comes to the protection of women, not only in a given crisis, but as well as a result of many problems that had led to the gender equality. And when it comes to the last constitutional amendment, which has constitutionalized the protection of women, and the state has now taken in protecting women in all the spaces upon or based on a constitutional article. And therefore, we had recently celebrated the International Day on Combating Violence Against Women. And this is, of course, related to the experience and this is as well related to how we can convert and how we can overcome, of course, this medical crisis, and how can some channels be established in order to end the suffering of women in remote areas. or at homes. And His Excellency, the President, has taken measures and exceptional measures when it comes to women, to pregnant women, and to women who have young children or children of a young age by providing them, of course, an unprecedented allowance, and which includes, of course, social protection and equality between or gender equality, which is, of course, a matter related to actually a culture which is entrenched in the Algerian society. And this is an experience that is a pioneer experience, in addition to the protection that is one very important related to developing women's economic capabilities and working on crystallizing rural areas. And His Excellency, the President, had, of course, entrusted the government with placing and with establishing a joint program for supporting women's involvement in national production and in national economy, which is something very important. And this was, of course, based on the protection of women's freedom and support, and which was as well embedded in the Algerian Constitution by means of sensitization or awareness raising plans involving all sectors, such as, for example, national solidarity projects for women, and that are established by means of its own units, and that are intended to providing social investigation in remote areas, to provide awareness and to provide support to women. Recently, we had started and we had this was as well related to the national campaign for combating violence, the 16-day race that was started by the United Nations, and we had established the social guide for supporting women in a very sensitive situation. It's a national guidebook related to all the mechanisms that developed by the state in collaboration with the social society to inform women as to the organizations it could resort to or the mechanisms it could resort to in the event of this very difficult situation, let alone its of course capabilities. This is as well related to the establishment of the economic guide that is related to developing the skills of women. This is, of course, related to women's social empowerment during the pandemic by means of the social platforms and the social media. We have used, of course, social media and social communication in order to promote the role of women, and therefore this was related to using, of course, the social media in the areas related to promoting the capabilities of women.
Thank you very much, Your Excellency, and thank you for sharing with us the Algerian experience and all the important steps and measures taken by the Algerian government. This is something that can benefit all of our countries. I do not see anyone else wishing to comment, so I will seize this opportunity to ask about the following. How was the platform used? Of course, it is important to have this platform, but to what extent was it used? And what are the procedures or measures that were taken? For instance, the women who reported violence and so on. How were you able as a community and as a society to support them or to help them? In fact, the e-platform the first e-platform that was launched is the family consultation platform, following a number of field visits, and after a number of cells and focus groups did or submitted their recommendations and observations as to how families were dealing with the health issues. And we saw that there was a negative impact by COVID on the family cohesion. There were many family problems between the family members. So we had to intervene psychosocially in order to alleviate those concerns, especially the concerns of the mothers and their wives. And we created this system in order to receive the complaints of the women and to direct the women on how to deal with the husbands, with the children during the lockdowns. Also, we encouraged women to access or to start productive activities. As you know, during the lockdowns, women stayed indoors in their homes and their families, so they had no. They did not leave the home due to the lockdown. So we used that time at home to develop and train develop the skills of these women and to train them using electronic platforms. Women were able to register remotely in order to undergo training sessions, and there was a high turnout, and the largest percentage of women and the microloans for women was during the lockdown, when women had to work from home, because most of the time the husbands had lost their income and jobs. So women stepped up, and so we helped by providing training, accompanying to them, and facilitated small projects and small enterprises using microloans for these women. Thank you. Thank you very much, Ms. Kawthar, for this overview. We did hear a lot about many countries that used those e-platforms for mental health and to provide mental health services to the people who could not leave their home during the lockdown. So they followed the same model as Algeria. Again, thank you very much for sharing with us your experience. A question by Mr. Isam Ali. The floor is yours. Go ahead, sir. I am Isam Ali, UNICEF advisor on GCC policies. I have a quick comment. We still have traditional categorization and classification of specific groups such as women, widows, children, and so on. So we need to develop those categories, because not all of them are in need. Furthermore, when we talk about governance, there are different administrations, and each administration has its own system of assistance, and we do not have records, unfortunately. And most of this assistance or aid is made based on applications, and this poses a problem in terms of the dignity of the person, and given the fact that some people can submit that application and others no, and the procedures take a long time. So we need to simplify that process. And to make this process accessible without having to go through an application process. Another issue is that this aid could create some sort of a dependency on it to resolve some financial problems. So are there economic and social empowerment programs that provide alternative to the families receiving that aid, so they do not rely permanently on this kind of assistance? Thank you, Isam. I see Mr. Munir Tabat, he had his hand raised. The floor is yours, sir. Good evening. Can you hear me? Yes, we do. Go ahead. A question to the colleagues, to the ministers with us today. There is the issue of institutional coordination, i.e. coordination amongst and between ministries providing their services to the citizens and residents on issues of social protection. There's also the issue of accountability of these institutions. Is this a challenge in your countries? If the answer is yes, how did you deal with it? Using what way and what method? Because we conclude from many discussions that there are challenges on this level. So, amongst you, do you have any experiences that you can share with us on this issue? The previous speaker mentioned the issue of, or the previous gentleman mentioned the lack of database and the lack of records. And sometimes there are many organizations and institutions providing social protection services, and we do not have proper records. So can you share with us any of this information and some of the challenges that you faced on this level? Thank you, Munir. A question was posed about the multi-sectoral approach. I understand that we in the health sector, we had an issue when it comes to the different sectors sharing their information with us. If any of the ministers present with us can share with us their opinion or share with us some of the challenges they grappled with and how they were able to address those, we would be very grateful. Go ahead, Ms. Wafaa. Good evening and greetings to you all. Of course, the institutional challenge is the most prominent one in light of COVID-19 and as part of the social protection programs, which are very extensive and large programs. We did face some challenges in our country, however, we did involve the different ministries concerned. For example, marriage support services and also 500 licenses or grants were given to people with disabilities, and this is considered a step forward in terms of cooperation between the different ministries. I'm sorry, the speaker is breaking up. I cannot hear everything she is saying. Apologies. In collaboration with the Ministry of Finance and other competent authorities using joint committees, the exchange of information and data. Of course, there are challenges, but with the joint collaboration, cooperation between the different ministries and we make new accomplishments and we provide better services. And I believe this gives a quantitative aspect to collective work, qualitative aspect to that work. This is what I can share with you from the Libyan experience. Thank you very much, Ms. Wafaa. Of course, we always say that disasters bring people together. There's always solidarity in times of emergency and disasters, sadly. But we hope that this kind of solidarity continues irrespective of the circumstances and in the long run, because we definitely need to enhance the multi-sectoral cooperation. Mrs. Kawthar, the floor is yours. Good evening. There are two speakers speaking at the same time. Apologies, sir. We have with us Ms. Kawthar, who will speak first, and then we give you the floor, of course. Thank you, and thank you to all the persons who made comments or asked questions. With regards to a unified social record and with regards to transparency and accountability, I can say that when a state is social and has a social policy, the multiplicity of parties providing social services is an advantage. And what we need to do here is control the type of assistance provided by other sectors, and also control the recipient of such assistance or aid provided by those sectors. And this is what the Algerian government is doing, using a unified social register or record, which will be the reference when it comes to determining those recipients eligible for assistance and the type of assistance received. Because what we want is we do not want the vulnerable categories to become dependent on such assistance, but we want them to integrate or become economically productive. And this is an approach that we try to enhance using the services of the Social Development Agency, which determines the recipients of this assistance across the country. Another approach, in addition to assistance and integration of those categories into the labor market using small projects and enterprises. The president of Algeria had established an institution that helps people engage in entrepreneurial activities and micro projects, and all of these are operating under the protection or under the umbrella of one ministry. And this is how we can control the unified social register as per the plan of the government. Thank you. Thank you very much, Mr. Ahmad from Sudan. Yes, hello. Good evening. The main discussion for Sudan is that we believe, or in Sudan, Sudan has witnessed some important challenges. Sudan as a country emerging from conflict, the problem was not limited to COVID-19. And there was also other problems such as displacement and refugee influxes, and compounded by COVID-19. I believe this requires some interventions. Sudan is in a vulnerable state as it is emerging from conflict and is in a transitional period towards democracy. So I believe that social protection policies for places emerging from conflict like Darfur have to have specific policies. Sudan also is grappling with the problem, with the refugee problem, which is compounding the situation for the Sudanese as well. I believe what Sudan needs right now is information. Sudan is a big country, a centralized country, and a big country, so we need information on how we need information, and we need technical assistance also to be able to receive information from the peripheries. We need access to remote areas in order to improve targeting, to improve follow-up and assessment and evaluation. These are challenges for us here in Sudan. So I believe what we need is a strong infrastructure of data and information to improve the targeting and of our population and to improve access to the remote population. Also, one important element that we must remember is that Sudan is emerging from conflict. We need to adapt social protection services to respond to the needs of the refugees and the displaced. And we need to make sure those social protection systems do not affect also the host communities in a negative way. Thank you very much for this opportunity. Thank you very much for your comments, sir. The issue of refugees is important not only in Sudan, but we know that in Sudan, this is a particularly heavy burden, and in the region, this is a problem in providing social protection to refugees and other vulnerable categories. Thank you very much. I would like to thank all the ministers and the speakers. I would like to thank all the colleagues. If you please, let's go back to the plenary session using the link provided to you at the beginning to join the plenary session. Thank you very much.